Is there a relationship between obesity and MGUS and smoldering multiple myeloma progressing to active myeloma?
So what's the role of obesity in patients with MGUS and smoldering multiple myeloma? So we know from many studies over time that obesity is a risk factor for both the development of MGUS as well as the development of overt myeloma. And an important and understudied question is whether there are things that patients with precursor conditions to multiple myeloma can do that's modifiable to reduce their risk of progression. There's some evidence, and we have a conviction that obesity and lifestyle factors, healthy lifestyle factors, is helpful to patients and may prevent progression. And early data from large observational cohort studies suggest that yes, aspects of a healthy lifestyle, such as maintaining an individual's weight, is helpful in terms of preventing progression. The key now is to how to operationalize that in the study. Can we show in a clinical trial that modifying aspects of body weight or obesity or its downstream effects, whether that can be a therapeutic target for patients with MGUS and smoldering multiple myeloma?